Key Performance Indicator of Hemodialysis Access Procedure Checklist Part 1B AVF and AVG needling, disconnecting. Explain the procedure to the patient. Make a preliminary evaluation of the patient's condition before disconnecting from hemodialysis. Make sure to report any signs of abnormalities. Check treatment time elapsed, prepare all medication required, and check the dialysis prescription. Perform hand rubbing or hand washing as per policy and procedure. Clean the bedside table with antimicrobial wipes. Open the on-off and back. Place the necessary consumables in the field. Don on sterile gloves. Withdraw 10 ml normal saline for flushing the arterial needle. Choose the reinfusion program. Make sure that the blood pump is off and clamp the arterial line. Clamp the arterial fistula needle and disconnect arterial line from the arterial fistula needle. At the same time, flush the arterial needle with 10 ml normal saline and clamp it. Disconnect on-line tubing and connect it to the arterial line using a dual connector. Release the arterial clamp and start reinfusion. Make sure that the blood pump is in between 100 to 150 ml per minute. During the washback, medications such as erythropoietin can be administered. Once the saline reaches the venous chamber, or the blood lines and dialyzers are clear, turn off the blood pump. Clamp the venous line and venous fistula needle. Disconnect the venous line from the venous needle. Remove the blood tubings from the machine and discard it. Remove the bibag and make sure that the machine undergoes heat disinfection. Clean the machine properly using antimicrobial wipes. After cleaning the machine, remove the gloves and perform hand hygiene or hand washing. Check the vital signs of the patient. Don sterile gloves and place a new drape into the AV fistula hand. Prepare the gauze into pad. Gently remove the plasters from the inner arm to outward direction. Hold the gauze over the artery needle site. Make sure to avoid applying too much pressure while withdrawing the needle. Remove the venous needle in the same manner. Apply pressure for 5 to 10 minutes for both needle sides. Hemostasis is checked opposite to the direction of the needle site. Once it's achieved, apply small dressing to each site. Secure with plaster and observe for oozing. Instruct the patient about the removal of plaster after 5 to 6 hours post-dialysis. Make sure to remove the 10 ml syringe from the arterial needle. Discard the needle in sharp container following infection control policy. Discard the contaminated consumables utilized. Remove the gloves as per policy and procedure. Perform hand washing. Clean the bedside table with antimicrobial wipes. Check the post-dialysis weight and record it. Do proper documentation in the Al-Shifa system. Record the post-dialysis vital signs and weight. Make sure to include dialysis assessments like presence of prolonged bleeding, trill, and bruit. Patient's general condition before leaving the center must also be included in the documentation.